Hi, I'm Dr. Mike Milligan. We are here at the initial meeting, the planning meeting for the American Academy of Oral Systemic Health here in Madison, Wisconsin. And I'm with Ellie Phillips, Dr. Ellie Phillips. Ellie, thanks so much for being with us.
Well, thank you very much for doing this interview with me.
Oh, you bet. Now, tell us a little bit about your history, and you're now in Rochester, New York, but you were in England, Rochester, and how this all came about, and then your passion for this. Ellie is an instrumental key person in this new academy.
Well, it's very exciting for me because it's really been a lifetime of trying to help people have better oral health and be able to take care of their oral health. Empowering patients, I would say, has been my motto for nearly 35 years.
Right.
And I started out being a dentist, one of England's first women dentists, and that in itself was quite an interesting challenge.
You bet. A lot of arrows in your back from that.
Plenty of experience.
But you were telling us a little bit about over in England taking teeth out on kids that just had cavities without anesthetic.
Oh, absolutely. Children in England were supposed to be seen and not heard. And when they went to the dentist, they had to sit in the chair and just basically have done whatever the dentist decided to do.
Oh my goodness.
And dentists in England were basically paid to take out teeth unless they needed to be heavily restored. Right. And baby teeth didn't qualify for heavy restorations, they were simply extracted. And of course all dentists know that there's a baby tooth, an immature tooth is like an umbrella guiding the permanent tooth into its correct location.
Right.
So taking it out prematurely simply means you're going to have all these ectopic eruptions.
Right.
Of course,
orthodontic
the British teeth are well known for being the worst teeth in the world. And I think it's a combination between infection, malocclusions, and the kind of dentistry that doesn't certainly help anybody have better oral health. So I, growing up in that environment, left.
Right.
I did an internship in a hospital and learned how to extract teeth pretty well, and I then left and went to Switzerland.
Okay.
Because in those days, this was before the common market. I am so old you can now classify it.
Golly.
They wouldn't let me work in any of the other countries. The only country I could go to was Switzerland.
Okay.
And every Swiss dentist could employ a foreigner. And I just happened to end up in almost a holistic office. It was so different from what I had experienced before.
Right.
And this weekend we've been talking a lot about nutrition.
Yes.
And that was my first experience of nutrition. We actually suggested tooth protective foods to be eaten at the end of every meal to basically alkalize the mouth, and it was pretty simple and straightforward, and it seemed like an easy thing for people to do to help themselves.
Right.
And the other thing we prescribed was fresh pineapple before and after extractions.
Okay.
And today, you know, I've been talking to the knowledgeable people here who understand exactly why pineapple would be a good nutritional benefit before and after extraction. So I learned an awful lot there, and I took that knowledge and went back to England.
Okay.
And that was a really interesting thing because I opened a preventive dental office.
Wow. Okay.
In the 70s.
Yeah.
In a country where all dentistry was free.
Right.
You had to pay for the services because they weren't covered.
Okay, the preventive services.
Preventive services.
Offered,
And you would be amazed. I mean, what happened was you end up attracting families. First, the mothers and fathers will bring the children.
Right.
When after a couple of years, particularly in England, they could see that their children were not getting the cavities that the other children were getting.
Right.
The next question from the mothers was, well, can you treat me?
Sure.
I would go to prenatal clinics, and I would explain to the mothers the acidity problems and dietary problems and baby bottle problems, and so they were pretty well educated, but they hadn't taken care of their own mouths. And if these mothers would come, and most women in England in that era, they would open their mouths and they'd have heavily filled teeth and active caries. Before we did anything, we stopped the disease.
Okay.
This seems so simple to me, so straightforward. You
obvious.
Don't dive in. And I liken it to repairing a floor with water damage.
Okay.
You have a kitchen floor and you have some water damage, and you bring in an expert and they put a new floor piece. And then 2 years later you have to call them back because it's gone bad around the edges.
Absolutely.
You call that secondary floor decay.
Right.
You then have a new piece put in, and then lo and behold, 2 years or 3 years or 4 years after that, you have to rip up the entire floor and put in a brand new floor with a subfloor. If you found out that that carpenter had not turned the water faucet off,
Yeah.
you'd be furious.
You would, yeah, you bet.
And I believe that's where we are with dentistry. And that's the only message I've tried to get across, that you have to cure the reason, the disease, the problem, before you start diving in. And I would explain to my patients that if you do this, there'll be a one-time treatment plan, and then maintenance.
Right.
And you will start to love dental visits.
Right.
And they did. They would come on birthdays, they would come as whole families, they would sit in the corner, and one at a time they would come in my chair. Children were excited, they saw their parents in the chair. There's no fear, everybody's being commended, everybody's being excited. What exciting profession to help people maintain health.
Absolutely.
And when I came to America, I was expecting that.
Yes.
I knew you did beautiful work. You did
Right.
much better,
Much better dental treatment.
I mean, the American Academy of
restorative.
Cosmetic Dentistry, the restorative dentistry, the prosthetic dentistry, even the periodontal dentistry.
But what you found was,
There was nobody talking about preventing or curing the disease.
Right.
And year after year, I would look for conventions, I would look for speakers, and then one day out of the blue, in 2001, there was an evidence-based conference
Right.
in National Institute of Health in
Right.
Bethesda.
right,
I booked my ticket, I jumped on the plane, I went there, I sat in the audience, and we heard evidence-based dentistry for the first time.
yes,
And they talked about caries detection methods, they talked about the ineffectiveness of certain things that we, the profession, have been talking about, toothbrushing,
right.
and
We've been talking about for years and years, but
you know,
really, the data and the research shows
don't
that
support
there
it.
are other things that are better to do.
How to do an examination. Should you use a sharp pointed explorer? You know, I mean, these are things that as dentists, to me, it's incredibly important.
You bet.
The military were behind me. They talked about xylitol use. The military start using it. And yet nothing changed. And it was because of that that gradually I became soured to the fact that are we ever going to go forward?
Right.
There's really, it appears, no money to be made in this. Yet I would dispute that, because I believe if you're fighting for patients to come to your practice,
Right.
you'll fight for the rest of life, because people don't want to sit in a chair, bleed, have a nasty taste,
Right.
be told they need to do things that they can't achieve. If they're trying to floss and they're not achieving it, it may not be flossing that's the problem. It
Right.
may be nutrition, it may be other things.
Absolutely.
And to keep yelling at these people and making them feel ineffective and bad, who wants that?
Right. So now with the American Academy of Oral Systemic Health, what are you seeing now?
I'm hearing, it's like an overture.
Great.
It's like sitting there in heaven to
Great.
listen to other people who felt the pain, who felt the frustration, who felt alone, who've been ridiculed, who've been ignored. And suddenly everybody is listening, everybody is paying attention.
right.
Now, we have to get the message of all of our messages joined together
Right.
and out there. But whatever I can do to help, I'm here. I'm so excited. It's amazing.
So we're joining together. I was one of the early speakers on Oral Systemic Link as well, and a lot of arrows in my back. But now we're really putting this academy together to combine all this information, to have a resource for this type of information on the best treatment modalities for perio and caries and et cetera, and how that affects the rest of the body, and the rest of the body affects the mouth. And so we're getting all of that together, the data, the research, and a protocol to go out and disseminate that information.
And I think the real key is that people have to be open-minded.
Yeah.
There's no good saying this is the only way. I've had a
Right.
particular way. My way, I work now with the public. I try
Right.
to empower people who've given up with their particular health professionals, sadly, because they're not being helped. So I give them the best over-the-counter help I can advise them. I can tell them which toothpaste I think is going to work the best. And I have nothing to gain in it. It's not my toothpaste. It's just I've done some looking at what seems to work. I think this organization, by combining, by being open-minded, by gathering together, offering options at different levels, we can achieve so much, and it's so exciting.
And promote health rather than just treat disease, promoting the treatment of disease. We're actually prevention and promoting health.
Absolutely, and you know, who knows where that may lead to? I mean, maybe it's connected with longevity. Maybe it's connected
Oh, it
with.
definitely is connected.
You know, I can't.
And quality of life, you bet.
So that might get attention. I mean, all the magazines I read tell me how to try to get younger looking skin, and now younger looking teeth, younger body, because your teeth are healthy, and very exciting.
Any last things you'd like to say before we close?
I hope everybody listens to the message that this organization puts out, and I really hope we can help first make an example of America and then take this to the world. And if I thought this was possible in my wildest dreams in the 70s, I thought I could do it in a community. This weekend, I believe we can do it in the world. I actually believe we can do it in the world. We just have to get a system and make it work.
Ellie, thank you so much for being
Thank
with
you
us.
for inviting me.
Great.